What's up, guys, and welcome to our. You laughing?
What's up?
What's up? What's up, guys, and welcome to our 7th episode of Clinically Correlate with Azfar and Vedant. In this episode, we have our very good friend Audrey Rich, one of our fellow R1s, who's here to share her amazing experiences on her life and work prior to medical school and why she arrived at diagnostic radiology. So, ready to get started?
Let's do it.
All right, Audrey, so the way we start all of our interviews is to imagine yourself sitting in that hot seat back in 2020, your first radiology interview. Interviewer comes on Zoom and then looks at you. You're trying to put on this big, hopefully real, but could be fake smile. And then they ask you, Audrey, tell me about yourself.
Well, it's great that I smile when I'm nervous. So that's already a positive. But so I have a very unique background because I am one of the older people in medicine, where I'm certainly the oldest in our resident cohort. And I was one of the oldest in my medical school class. So I've kind of had a life before medicine. Originally from Albuquerque, New Mexico. I went to undergraduate at the University of Northern Colorado, and I was very fortunate to play soccer there. I studied cellular molecular biology with the plan to go on to medical school, but then when I graduated, kind of had some second thoughts and decided, maybe I shouldn't do this, or maybe I should postpone this, and instead joined the family business. So I grew up in the construction industry. My family owns a general industrial commercial general contracting company, and so that means that they build things like schools, churches, government buildings, stuff like that. And I thought, well, hey, I could do this, and medicine is always there, I can go back. Well, this was in 2008 when the housing market kind of crashed and industry crashed, the construction industry crashed. And my family kind of looked at it and said, well, Audrey, if you're really interested and serious about this, you need to earn your stripes somewhere else. So go find a job that's not part of the family. Because being the boss's kid and not being the boss's kid is definitely a different experience. So from Colorado, I moved to Oregon and took a job at a industrial commercial construction company there. Hated it. It was horrible, terrible. Realized that I did love medicine, or at least love the sciences. And so from there, I took a research position at the University of New Mexico and was a research tech for a number of years. And felt like, okay, well, I'm getting kind of old in age, so maybe physician assistant school is like what I should do, because it's only 27 months and my interests are very, very wide and I can switch specialties. What I really care most about is patients. And so, great, I'll do that. So I went to PA school. Then from PA school, I joined a surgical practice in Albuquerque, did things from hepatobiliary surgery, emergency general surgery, surgical oncology. I also kind of dabbled in cardiothoracic surgery for a little bit, and over time could see that there is a ceiling when it comes to being a mid-level. And I could see my senior PAs at about year 10 start to switch from specialty to specialty, or switch from clinical practice to administration. And really, it's kind of because they were at the peak of their practice. And there wasn't really anywhere to go from there. At least that was from my perspective. And I wanted to do more. This is maybe year 4 or so. Wanted to do more, wanted to see more, wanted to see sicker patients. And then it was like, well, I'm single. I don't have kids. Like, great. I guess I'm going to medical school. So then I decided to go. I got into the University of New Mexico, and the rest is history.
That's awesome. I mean, like you said, definitely a very unique story.
Yeah. And there were things that I liked about kind of each stage. So being a research tech, I really loved the troubleshooting. I loved the cellular molecular aspect of it. I loved kind of being at the forefront because I did a lot of clinical trials with like oncologic cellular molecular research. But there just wasn't enough human-to-human interaction. And being a PA was really great because I liked the collaboration. I liked how I could go from, CT surgery to EGS to hepatobiliary to colorectal. And that was really rewarding, and I got to work with a whole bunch of different specialties within medicine, especially being a PA. I mean, I kind of had friends all over the hospital. But like, I really enjoy radiology and where I am now. So
we'll definitely get into that.
Okay.
But I feel like, we're at a good transition point now because you've worked not only in a career that is different from being a physician within healthcare, like being a PA, but you've also worked a career that is not medically related at all, which is construction. There are multiple reasons why you kind of transition from one into the other.
Right? Yeah.
I guess, circling back all the way to, it's up to you on where you want to start. Circling back all the way to either college or in a construction business, right? What are some key lessons that you learned, whether it was Division I soccer or whether it was your work in being a research tech or whether it was your work in the construction business? Like, what are some key lessons that you took away that ultimately helped you in being an efficient or a good PA or, being an efficient or good physician?
Well, there are several. I think the first thing is it's important to approach every single relationship, every single conversation with someone with the idea that they know something that you don't. And this holds true whether you are talking to your cement supplier, whether you are talking to the excavator operator, whether you are talking to your nurse on the floor, whether you're talking to your attending physician. If you approach every single conversation that way, the amount that you will learn is unfathomable. And so I've really my whole life has been approaching individuals that way. And I'm a very curious person. And so everybody is a very interesting person. And if you let them talk, they will share with you things that you can't even imagine. Mm-hmm. And so I have learned a tremendous amount from working in construction. In college, not only was I Division I soccer, but during the free time, I was also a heavy equipment operator.
Wow.
So, yeah, you would never guess that little 5'2" me, petite Audrey, would hop into just about every single piece of construction equipment that you have ever seen, because It was Ritchie Brothers was a construction, farming, and mining auctioneering company. So during our quarterly auctions, I would be the one that would drive these pieces of machinery across the auction block. Wow. Now, I can't operate any of them because there's a difference between driving and operating. But every single piece of equipment from trash compactor to roller to excavator to skid steer, I know and I've driven. So it's that's very interesting.
Yeah.
But also it's your work ethic.
Yeah.
And no matter who you are, what industry you're in, everybody appreciates a good work ethic. And you will get so much respect if you just buckle down and grind. As the driver, as the lowly research tech, if you just work hard and not think of the work as beneath you, you will go very far. And I think that a lot of people, especially now, and younger people, have really lost that humility. Talking to someone who thinks that you know has something to share with you, that they know something that you don't, and working hard, I mean, both those, I think, has a very, an aspect of humility. And carrying that forward will really go far.
Yeah, I think, definitely couldn't agree more. One of the things that you need to get into medical school per se is, volunteering. How many times do we actually use, volunteering during medical school, right? Not many of us have to or use it, especially those pursuing surgical specialties. But regardless of what you want to pursue during medical school, you need volunteering, both clinical and non-clinical, to get into medical school. And I feel like that's nowadays is a very hard requirement. That you can't just have good grades and a good MCAT score to get into medical school. The reason why that's still important is because, again, first of all, that work is never beneath you. Second of all, it instills you viewpoints and values that are important to become an empathetic person, to kind of see people who are, I hate the term less fortunate than you, but in different circumstances than you.
Yeah.
And to kind of help out in a way that you can, no matter how small, right? That's the key. So I think it's an absolutely crucial mentality to have to, first of all, just learn unique experiences of people, but to, second of all, just kind of come away with experiences and sort of mindsets that help you further along in your medical career and beyond, right? That you developed during your work that you never would have thought of, during your work in construction or as a lab tech. A lot of us will probably see that work, or when we start as a lab tech, a lot of us did research in undergrad, but we probably saw it as sort of a pathway into medical. So it's just a checkbox that I got to check off.
Sure, yeah, absolutely.
But it's so important to have that open mind and to kind of absorb as much as you can. And then again, look at the overall goal and grind, right? Get the work out there, set up your work ethic, right?
Yeah.
I mean, we all did it when we studied for step 1 in medical school, right? We had to grind. We knew that score was important. We hated that stupid information, but again, there's a lot of stuff that we need to learn.
Yeah, I mean, and really the people I think that are listening, everybody in medical school just about has a tremendous work ethic, but I think a humility cannot be understated.
So you brought up an interesting phrase. You said, the young generation, right?
Oh, God.
So I get I guess you, you're kind of on the cusp of like 2 generations, right? We probably are like the youngins to you, and I think like especially now with like the incoming like medical school class, which we're not that far away from in terms of our training standpoint, are definitively like Gen Z, right? Like they would be like 20 right now, or like 21, so perfectly Gen Z. And so like do you like, was that something that you were very conscious about, kind of like once you went back to med school, and like feeling like there was a generational divide that like you almost like could connect with your attendings in terms of like their philosophy or like things that they didn't think the younger generation was doing as well as they did?
It's so funny that you're bringing this up because in so many ways I could connect with the attendings, with the residents, and with my fellow students on 3 different levels. So for example, like when it comes to personal relationships and families, things like that, I was much more kind of in tuned or along the same lines as like the attendings, fellows, maybe some of the residents. But then at the same time, I'm in medical school with like my fellow classmates, and there's such a definitive hierarchy in medicine. And it's almost like, oh, you don't fraternize with people that are like not on your level. I mean, how often do you have beers with your attendings? Like some people do, but like it's not very often, or it's not like, oh, hey, let's go play tennis. Like with the medical student, like you might grab beers with the medicals, but you're not going to be like, oh yeah, let's go hit the slopes. So it was, I do feel like my life at this point, and maybe even still now, is a little compartmentalized. Like my medical school friends, it's like this, but then like these friends, it's that. And it was challenging being in medical school because I started medical school about 10 years after I had graduated college, or 9 years after I had graduated college. So I kind of felt like, oh gosh, these people are just so sharp and they're so smart. And my gosh, like I'm learning the Krebs cycle and they've discovered new enzymes since I like was learning biochemistry. So it's like, how in the world am I supposed to learn this? This is like day 1, and these people just had biochemistry last semester, like piece of cake. And so that was definitely a challenge in medical school, trying to keep up with these people around me. And it's, I mean, that was tough. That was really, really hard.
So circling back, you kind of walked us through how you got to medical school. Can you tell us how you found radiology?
So, initially, of course, I was a surgical PA, so I'm going to medical school to be a surgeon. There's really no question in my mind. Yeah, and I was good at being a surgical PA too. I loved the OR, and I love anatomy. And really kind of everybody expected that of me. I expected that of myself. But I knew the lifestyle of an attending. And I knew the lifestyle of what a non-academic attending was like, because I worked in a nonprofit hospital, and without residents. And these attendings worked really, really hard. I worked with someone who was in his late 70s who was still taking night call. That's nuts. And so when I went into medical school, I thought, okay, that's just the general surgeons. The general surgeons were really the ones that got crapped on the most. So I'm not going to do general surgery. And so throughout medical school, I really investigated a lot of these surgical specialties. I thought that orthopedics might be a really good fit. They're kind of a bro-y specialty, and I'm from construction, and I'm an athlete. And so kind of I fit the prototypical bro-y chick that can hang with the guys. And as soon as I was with ortho, it was kind of like back to construction again. I thought I would like it, but then as soon as I got there, I did not like it. And so it wasn't a good fit. Then I thought, okay, well, I did CT, didn't like CT, did hepatobiliary, did surgical oncology, now ortho, plastics. Love the soft tissues. The surgeries there are amazing. You get to do all of these flaps. I like the soft tissue part of general surgery the most. I like how delicate it was, how precise it was. And with plastic surgery, I really liked that there was a lot of collaboration. When you operate on the face, you can work with ENT guys, you can work with the OMF guys. When you can go into hand, so then you're working with ortho. You can work with neuro a lot of times when you're doing these like delicate operations with like nerves. You can work with vascular when you're doing a lot of like pedicle flaps. And so then I spent a lot of time with plastics and was pretty set on going into it. But that really wasn't a good fit personality-wise either. Now, my roommate in college was also going into plastics, and she and I got along very, very well. And at the last minute, she bailed for radiology. And one of my research projects in medical school was this case report, and it had a lot of imaging. And so I distinctly remember calling up the radiology department, and they were so helpful, and they were so nice. And I ended up talking to the clinical coordinator or clinical director for medical students, and I didn't even know she was attending or so high up. And she was just really encouraging, like, oh, well, God, if you like this, why don't you just do a rotation with radiology? And I must have talked to her for 25 minutes. And she just really left this lasting impression. As soon as I got off the phone, I had a 2-hour conversation about radiology with my roommate. And then it was like, this could be something. I think I could like this a lot. And then I called up my buddies in private practice that I worked with 4 years prior, who, looking back, I spent more time hanging out with the radiology department at my old hospital than I ever did with the surgery department. I mean, I would go to their baby showers. I was on their mountain biking team. I would go grab beers with them after work. I'm good friends with a whole bunch of IR techs. And it was like, well, the personality kind of fits. I'm already hanging out with the radiology group more. And so one of these radiology guys was like, Audrey, why don't you just call up one of my private practice plastics friends and talk to him. See what attending life is like before you make this decision. And so you're really well informed. Boy, I couldn't imagine going into that now after that conversation. It kind of really sealed the deal. This individual told me that when he tried to open up a private practice place in Scottsdale, Arizona, the local plastic surgeon invited him and his wife out to dinner and said, basically, you're not welcome in this town, and I'm going to do everything I can to shut you down. And that includes bad reviews online, that includes bad press, whatever it is. And then he tells me that he tried opening up a plastic surgery department. He left in Colorado Springs. Well, he couldn't get hospital privileges there because the local plastic surgeons were on the hospital board and wouldn't give him hospital privileges. So now he goes to Denver. And you can't really trust anybody to take call for you while you're on vacation because they could take your clients. So every single family vacation, he has left prematurely because he has had a patient emergency. And that was not the life I wanted. He also said that I didn't have to choose that life. I could go into academics, or I could work part-time. But then if you're not operating 40 hours a week every single week, you're going to be a bad surgeon. And that was non-negotiable for me. Patients deserve better than that. And so I thought, well, if I'm going to be a surgeon, it's going to be full-time. I don't really want to do private practice. And do I really want to be an academic plastic surgeon doing cases that are maybe 18 hours long when I'm in my 40s and 50s and 60s? And so I kind of thought, why am I doing this? And then it was like radiology was all of the things that I liked about surgery with all of the things that I hated. Like, it was just great. I mean, the anatomy was there, the lifestyle was there. I loved the physics of it, and it was just such an exciting field. So it was like a no-brainer.
I love how animated you got. You're like discovering it again. Like those emotions are coming out. It's like, oh yeah, radiology.
Yeah, yay, radiology.
Well, I think what's interesting is like seeing like whatever the end profession or end specialty at like the different stages, right? Like whether it's like seeing the residents in their life or the like first couple of years attending or private practice or academics or like 20, 30 years down the line. Like it sounds like you had like such a broad, like a breadth and depth of like, you know, secondhand experience or like talking to friends and mentors that way that like really kind of shaped your decisions, right? And like I think for a lot of us, what ends up being a bigger kind of consideration, you know, you don't necessarily think about the flexibility of your lifestyle, right? And like it's really hard to imagine what you want at 40 when you're like 25, right? And making these decisions. And it's like, you know, sometimes I kind of look back and be like, maybe the people who were like Durham from day one, like they kind of knew something that we like, you know, the people who are like, I want to do neurosurgery or something like that, that like, I want to be busy, that like at some point, and especially after intern year, I was like, you can have all of like your ambition to work taken out of you by working 100 hours. Like you will, if you want to work, like they will feed you so much that you're like, I never want to eat again. And like, that is something that like, I feel like only experience can teach in a way. Cause it's like theoretically it's like that thing is so cool. I want to do it. But there's a lot of steps along the way and a lot of time to just get good at it.
For sure. And as medical students, I mean, this cohort of individuals are so driven that they really can work themselves to death. And the blinders that you have to put on to get through medical school, to get into medical school, then to get through medical school, it's so easy to keep them on. And it's like, okay, just get through step 1, just get through step 2, just get through intern year, just get through residency. And then it's like, it doesn't end after fellowship. I mean, that type of grind is required of you when you are an attending, whether you're an academic attending or private practice, especially in surgery. And so I wasn't about it anymore. And it's kind of hard to talk about that with someone who's 25, that what you want at 25 isn't necessarily what you want at 45.
Yeah. And I think that, I mean, that's unfortunately the biggest problem or challenge really in medicine, right? Is like we sign up for these like 4 to 6, 7 year like commitments that you're just like locked in, right? And like starting from like 18 when you're like, I'm pre-med, to like even say finishing like your training when you're 32 or 33, if like you're young and you go through everything, right? Like you really can't even conceptualize it, right? And like along the way you try to have all these like life events happen and like, but like it's not the same as someone who's kind of like working 9 to 5 and like they have their weekends and like they have their like 6 weeks of vacation and like they don't have all these like variability that we do.
How do you know what you want at age 25?
I mean, I don't know if anyone actually knows what they want ever. But like that's a global, you know, philosophical.
Are we ending with this philosophy?
I'm just saying, like, do we ever really know? Like, you can only make your best guess decision, and like maybe good or bad, like we lock ourselves into 4 or 5 years, and like it's like no matter what your emotions are, you're still doing something else. Like,
yeah. And when people pick their specialty, especially when they pick surgery, it's like, well, if you can't imagine yourself doing anything else, then do surgery. That's what they say. That's what everybody across the country says. Right. But really, the first time I walked into the OR and the first time I saw a cadaver, my breath was taken away, and it was a very moving experience for me. But everything becomes routine and mundane when you do it every day, even neurosurgery. And so the first time you crack open the calvarium and you look at the brain with all of its glory, it's going to be a awe-inspiring moment. But when you do that 7-8 times a week for 30 years, well, it's just another brain. And then it's like, I'm just opening up another brain, and I'm not at home watching my kid take his first step.
Right.
And what kind of choices are you making then at that point too? So that stuff also weighed in my mind.
I think the whole pathway is built on that, right? You kind of tying you down to the hospital. Like, think of the level of our training and what is called, like, we are residents. The term came from people living in, or trainees living in the hospital while taking care of patients. There used to be hospital wings that are built for us to live in, basically, 24/7, and take care of, and quote unquote learn to take care of patients, right? An extension to that in the modern world is all our call responsibilities. The fact that, we are not, there's some sort of a cap in our hours, but we are not paid by the hour, and our responsibilities are basically unlimited, or whatever the administration and the senior leadership thinks is fit for us to do, right? In New York, it's like, we're very lucky to be in Pennsylvania, where we have a very supportive and collaborative environment. But I think in our last podcast, we were kind of talking about, I kind of brought up kind of the experience of my dad training in New York City, where, if someone doesn't want to get the job done, it falls on the shoulders of residents. And at the end of the day, the administration knows that these are warm bodies who will do whatever they have to do to finish their training and get that training certificate, right? It's unfortunate that our training is in some ways kind of built on the old system, and the old ways of thinking are still prevalent, but I am hopeful that, we'll at some point in our lifetime sort of move past that and start seeing our residents as people, who have lives outside of the hospital, right? And our radiology program honestly has accommodated that vision in many sort of ways, right? As R1s, first years, we have all of the major holidays off, right? We have most of our weekends to ourselves, right? We have a semblance of normal life, which a lot of other specialties don't have. And I don't know about you or like Vedant, but for me, that was a huge driving factor into diagnostic radiology. As an older person who has been married since first year medical school, who has been thinking about having kids and being present in the life of my child, of course, these things are important to me. I was interested in so many different specialties. I could have done IM, neurology, any sort of I was looking into ophthalmology, ENT, but at the end of the day, nothing provided the flexibility of diagnostic radiology. And of course, I was interested in it as an academic specialty, learning about different systems, kind of looking at the whole body, being the general consultant for every single service. But I would be lying to you if I told you that, hey, that lifestyle factor absolutely did not play into my decision. It absolutely did. And I'm sure on some level it plays into everyone's decision.
Yeah, I believe that. Absolutely.
I agree. I mean, that's what I was saying. To your point of, if you can see yourself doing anything besides being in the OR, do something else. But it's again, when you're 24 and you're like, well, the difference is I'm home alone with a roommate, or I can go out, or I can be in the hospital. Yeah, it's a lot more interesting. But when I think you get older and you just have different commitments that are also valuable and meaningful in your life, right, and kind of contributes to a broader society or your family, you have differing, competing things for your time, right? And it's just, I think, the lack of flexibility that other specialties, whether it's night call when you're 70, it's never ending and always demanding, right? Yeah. So it's definitely something that even say 2 years, especially after intern year, I kind of have a different perspective now than I even do 2 years ago.
And for sure.
As my wife being a urology resident, very thankful I'm in radiology, because
direct comparison.
Yeah, it's a 1-to-1, and because I remember how it was at the end of intern year and just dead exhausted, and it's now it's you don't feel tired all the time. You can hang out with people. You are kind of exploring different interests and passions, and it's just like I've always told people, like when you overwork, it's like overtraining one muscle, right? And it's like you just did like bicep curls your entire year. Like your legs are like chicken legs, right? Like, and you like are like you can just tip that person over and they'll fall. And that's what like just working. Like it's not that you don't like making your biceps look big, but you're not a complete person,
right?
And I think that's that's that sense again. It's like something that's like once you felt it, like it's so like it stays with you, right? As like a memory of like I don't want to feel that way, but like you can. It's very hard to explain to someone who hasn't gone through that. Right. Who also has that vision of, I want to do this ambitious thing, right? And it's like, you can, and like, for the most part, maybe like the youth, right? Like genuinely, like, they're going to do what they're going to do because we all like kind of headstrong do something.
Yeah.
And like, it's just, all right, once you've done that, what's the next stage in life?
Wow, that is such a profound statement, like with the biceps, because that's probably the best analogy I've ever heard about becoming a physician, is that you are so one-dimensional because you don't have time for anything else.
Right.
And I remember thinking, I want to be more than a doctor. I want to be a friend. I want to be a sister and a daughter and a wife and a mother and all of these other roles besides doctor. And when you're, at least what I felt was when you're a surgeon or some of these other specialties, there isn't much room for anything else. And God, it's great to have like good looking biceps or like good looking abs, but man, if that's the only thing, you're an incomplete person.
Yeah. And I think, I mean, it's to some extent like, we normalize the amount of work hours, right? And like, like as a general surgery intern, like I saw the same thing of like from chief resident to attending, your life doesn't get better, right? It doesn't like, maybe it gets a little bit easier not doing like scut work all the time, but like you're still operating like crazy. They're all still tired. And like my first month, like the trauma section got like gutted for like political reasons effectively. And so there was like, if there were usually like 10 trauma surgeons, there were 3.
Wow.
For like a level 1 trauma center in Tampa, where like all of like the Southwest Florida flies in for anything major, and like these guys are like 2 of them are in their 30s, like one guy's like 55, and like they literally worked more than the residents from a general surgery program. Like they were on for like 3 weeks straight. One was just doing 12s in the morning, like I was doing 12s at night, like, and then one person was covering the weekends for like 12 to like 24-hour shifts at a time. So like. It's just brutal. And like, you can't do anything. Like, they have your contract. They're like, and you don't want to leave because it's like, then who's going to do the traumas there? But like, the guy was like, I haven't seen my daughter in like 2 months. And like, it's like the end of the summer. So like, that would have been the time for me to see her.
The neurosurgery department at the University of New Mexico got canceled while I was in the midst of school there. And all of the residents, of course, then went on to other programs. And I believe that there were 2 residents per class. So what is that? Is that 14 residents?
Yeah.
I think, so then they hired NPs to help with all the scut work. Mm-hmm. I want to say that they hired 40 NPs to replace 14 residents.
Yeah, I think there was a version of that story floating around online.
It's
actually.
True.
Yeah.
It's all true.
Yeah.
So you can, 40 to replace 14 people. That's like that is crazy.
And again, it's not because, let's say let's say that the work that the NPs are doing are on quote unquote equal footing to the work that residents would be doing. It's the fact that they bungled the residents down with so much work that an NP with common sense would just say absolutely not to that level of work, right? And they would take on the normal amount of responsibilities that an NP would, and to just replace the amount of work that each resident is putting in, they had to bungle in more NPs because they just wouldn't take the abuse.
Right.
And they know that they calculate by hours, and they're like, I want to work 30 or 40 hours. Right. And like, you could just tell them, oh, this is taking longer than 40 hours. What are you going to do if like they need to leave at 4:30? Yep. Right. So like, I don't know, they clearly are getting, maybe you can speak to it, but I feel like NPs and PAs have like negotiation classes that students and residents do not get. Because I swear to God, like every PA job is like 8 to 3, and it's like, yeah, and the physician works like 6 to 10, but like they just figure that they can't bargain, like negotiate. So like the hours are great.
I mean, yes and no. I have some friends that have worked some pretty terrible jobs, because it's almost like, well, I want to be an ortho PA. And an ortho PA, they're on call. And it's cool to be an ortho. But then, certain groups, it's like, well, who wants to take call? And it's like, we'll get the PA to do it. And so, or it's like, we'll pay you an extra $50 an hour to take call. And when you have so much debt from PA school, sure, I'll take an extra $50 an hour. So great, you're making $100, $150 an hour to take call, and you're 25, 26. Like, I mean, when we're 25, 26, you could work those hours, and now you're getting $150 or $200 an hour. Like, that's great. And so, I mean, it's definitely a trade-off. I mean, here we're kind of taking that experience with us, and I feel like the PAs and NPs, they're cashing out. So it's a trade-off.
Right, and they have a shorter educational pathway, right? They're not in school as long as us. So as you said, they're younger, hence they can take on those responsibilities, and I bet when they get a little older, they wise up and sort of regulate those hours.
Totally.
Right?
But then they also have the experience. I mean, they cashed out, and then now they have the experience. And
right.
If you're an ortho PA, or if you're an orthopedist, like, you would want an orthopedic PA with 10 years of experience. I mean, those surgeries are great. You're in those surgeries, and it's almost like this dance with the operator. And it's really a neat experience when you know that the PA that's with you is handing you the suture, and at the same time you're handing the suture to your surgeon with one hand, you're accepting like another instrument with the next, and it's just this back and forth dance.
Yeah.
And you only get that with an experienced PA.
Yeah.
And so, I mean, it's pluses and minuses, no matter how you cut it. They talk about flow in like a lot of the high endurance or like extreme sports. Mm-hmm. And I have experienced that in the OR several times, and it is so rewarding. I mean, time just stands still, and it's just this beautiful dance in the OR doing these operations. But like, you walk out and it's like, oh my God, I can't believe it's 6 p.m. Yeah. But then, there's a price to pay. Yeah. And I feel like you can find that in other fields too.
Thank you so much, Audrey. This was a wonderful conversation. For everyone at home or wherever you're watching this, hope you had a wonderful time listening to this conversation. It's another great episode of Clinically Correlate with Azfar and Vedant.